Welcome to the body imaging cases. This 30-year-old lady presented by right ptosis, MRI of the brain with particular emphasis on the anatomical location of the oculomotor nerve was normal. Gadolinium-enhanced MR angiography of the head and neck showed stenosis of the right vertebral artery at its origin. Here you see it is missing along its whole course compared to the contralateral artery. In addition to the right vertebral artery stenosis, we have a couple of important findings on the venous side. There is narrowing of the right innominate vein and heavy vertebral venous collaterals as an alternative pathway for venous drainage inside the spinal canal. So the findings point to a lesion at the mediastinum, which is the cause of the ptosis. T1 weighted images showed that there is a lesion of the right side of the mediastinum replacing the mediastinal fat. Replacement of the mediastinal fat is obvious on this Dixon method fat-only image that shows replacement of the right side of the mediastinal fat by non-fatty tissue. The lesion is enhancing on gadolinium-enhanced images and keeps this enhancement on the delayed images, a feature of a tissue that contains a lot of fibrous tissue. And it has shown low signal intensity on T2 weighted images, another feature of lesions rich in fibrous tissue. A third feature of fibrous tissue is the concave outline of the lesion. Due to the retractile nature of the fibrous tissue, unlike other expanding tissue, such as, for example, lymphoma, since we are talking about the mediastinum. PET-CT showed intense uptake of FDG, denoting a very hypermetabolic lesion, which is still showing this retractile nature that results in its concave outline on all sides without displacing the surrounding organs, soft as they are. Mediastinoscopy and biopsy were performed, and the lesion was described as pale and avascular. The histopathology diagnosis revealed fibrosing mediastinitis. CT angiography was done to show the extent of the vascular stenosis. And this is the stenosed right vertebral artery because it is entrapped within the fibrous tissue lesion. Here it is on the three-dimensional reconstruction. Now you see the right vertebral artery on your right-hand side because we are looking from the back. Notice how it is stenosed in relation to the normal left vertebral artery. And because sometimes there is discrepancy in size between the two vertebral arteries normally, we have to look at the flow in the vertebral artery to know if this is just a normal variant or it is due to the entrapment of the artery at its origin by the fibrous tissue. On this bright blood imaging, both arteries show normal bright signal at this level. However, at a higher level, the right vertebral artery shows impaired flow. Coming to the details of the venous stenosis, this is a three-dimensional reconstruction of the CT. Showing narrowing of the right innominate vein at more than one site. The PET-CT offered a good baseline of the lesion's activity before treatment. Treatment with rituximab and steroids had a very good effect, evident by the absence of FDG uptake by the lesion after treatment. This is the positron emission tomography before treatment, and this is the positron emission tomography after treatment. However, treatment of the lesion's activity is not the whole story. The narrowing of the veins may be more difficult to treat than the disease activity, and repeated angioplasties may be necessary. Now, on a PET-CT done after treatment, there has been an active uptake of FDG again in the mediastinum, this time more anteriorly located. New disease activities? The answer is no. This is activity in the thymus due to thymic rebound, which disappeared spontaneously on a subsequent PET-CT. So looking at the timeline in a glance, this is uptake at the initial diagnosis, good response to treatment, thymic rebound, disappearance of the thymic rebound. The diagnosis is idiopathic fibrosing mediastinitis, and the learning points are fibrosing mediastinitis may be idiopathic or due to prior histoplasmosis infection. It causes vascular stenosis due to encasement of the vessels by fibrous tissue, both on the arterial and on the venous sides. Ptosis has been the presentation in the present case, and ptosis due to mediastinal disease can be explained by one of two mechanisms: the involvement of the sympathetic pathway as a part of Horner's syndrome, or, as in the present case, also due to stenosis of the right vertebral artery. The concave outline of the mediastinal lesion is more in favor of retractile type of tissue, such as fibrous tissue, more than the expanding lesions like lymphoma. Two other features of fibrous tissue on MRI: the low signal intensity on T2 weighted images, and the progressive or persistent enhancement on the delayed gadolinium enhanced images. Thymic rebound is enlargement and hypermetabolic state of the thymus on regression of certain diseases. It is self-limited and should not be mistaken for thymic disease. Treatment by rituximab and steroids is effective, but vascular stenosis may be difficult to treat and requires repeated angioplasty sessions.